Well, thank you very, very much for inviting me to this evening, and thank you for coming out. I've read Josh's writings for quite a few years. Occasionally we've emailed, but never had the pleasure of meeting him. He's very thought-provoking and good researcher, good numbers. I don't necessarily always agree with him, but my late colleague, Marion Levy Jr., once told me, when have you ever learned anything from anyone with whom you always agree? And so I read quite a bit in the Pioneer website, and as I said, they're very good numbers. Now, my initial title, we had some exchange. I would have liked to talk how great America is and just talk about that. But Josh insisted we stay with this topic, so there we go. I will do that. First of all, what just happened? And I was reflecting. What happened is basically crippled Congress passed a very complicated, one might say messy bill. This should not, by the way, if you can't read these slides, they are my notes, so to speak, and I think Tom had the same attitude. Don't feel bad, we'll talk about what's on them, and if we change our minds, we just lie about it. A messy bill is the best we can hope for in this country, unless we pass a Christmas tree bill like we did in the Medicare Modernization Act of 2003. It had benefits for everyone, for the elderly, it had benefits for the insurance industry, for the drug industry, and it wasn't financed. Those are elegant bills. They are very easy to do, and of course it was also drugs, which is a commodity, and it wasn't coronary bypasses or Salvati pills or very complicated things. So that you can do, but I think the well of debt financing was exhausted by this time, and this bill had to be financed, and that adds a lot of the agony to the bill, particularly a lot of losers that you wouldn't otherwise have. To my mind, it's a miracle the bill passed at all, and on balance, I favor it. I want to put that up front. Now, if you think the Affordable Care Act is a mishegas, I invite you to look at another alternative proposal penned at the behest of the American Enterprise Institute by 8 top American health economists, Amitabh Chandra from here, Mike Chernow, and from all around the country. You can just Google American Enterprise Institute, the best of both worlds, and you will get this. You will even get a video of a presentation at the Institute. That's it, the best of both worlds. And what those economists tried to do is they tried to not have community rating, where you have to raise the premiums for some people, as Tom explained, to lower them for chronically ill and older people. You don't do that. Rather, you charge actuarially fair premiums, which means if you're sicker, you pay more, and if you're healthy, you pay less, which had been the approach until 2014 in the individual market. And Americans were whining and weeping all over the pages of USA about it, and beat up on the cruel insurance companies who, when you came in on a stretcher, very, very sick, charged you more, because they could realize you would cost them more, right? And that was considered un-American. You would have to reveal your entire medical history, of course, to proper price your policy, and your sisters, and your mothers, and your dads, a total invasion of personal privacy, which is what that individual market did. And this is one thing I would credit to the Obamacare, the fact that you no longer have to reveal all your personal medical history to a perfect stranger across some electronic farmer's market, to my mind, is a plus that should be acknowledged. I personally, because I'm employed, never had to do this. I would consider this an enormous invasion of privacy to have to reveal to everyone, not only mine, but my sister's medical history. So my reaction to that whole idea is mazel tov. If you wanted to implement that bill, that would be much more horrendous than what we have now. But that was the alternative so far. Now, why is the Affordable Care Act so messy? First, it is a small patch on an extremely convoluted health insurance system that is in itself a mess. So if you put a patch on a messy system, that patch will have lots of stitches and be very, very complicated. And so it's inevitable. No one, I think, could have written a simpler bill, frankly. To illustrate, I'm an immigrant. I've actually, you can tell by my accent, just recently got here, 40 years ago, but in the sweep of American history, it's not a long time. So I've studied the American people, which are a distinct human species, that's for sure. Now, I'm a Canadian, and we're pretty dumb people, actually. We make distinction between plants, animals, and humans, period. Now, you look at me and say, that's it? That's it. That is not the American way. The American way, we have plants, we have animals, and then we have young humans, adult humans, elderly humans, poor humans, near poor humans, middle class humans, rich humans, and for every category in every state they are different. I've come to believe that Americans do not have the same number of kidneys. It must vary, which is why one size doesn't fit all in the land of McDonald's and a Holiday Inn and everyone else. How often do you hear one size doesn't fit all in the land that invented one size fits all and on it built a great economy? See how a foreigner has trouble, particularly when you have the simplistic mind of a Canadian, how hard that is to grasp. Well, I once was in Indonesia, Bali, where you have the clearest thinking. It was a World Bank conference, one of those junkets. You've been on it. Your buddy, Joe Antos was on it, and I still have his cross-dressing slide, but that's another story. But we were asked, who is responsible for a sick American? And we Americans at the conference looked at each other dumbfounded, and I said, what a ridiculous question. And I got on the board, and I wrote this flow chart. I said, to answer this question, you first of all ask, how old is this organ that's diseased? To what body is that attached? If that body is 65 years or older, it's clearly a federal responsibility. Now, what if that body is younger than 65 and this organ is diseased? You ask, is it a kidney? Because if it is a kidney, the shape of a kidney makes it federal. It's in Medicare. If it's a liver, no. Liver is state and local, maybe, or your own. And it just goes on. Actually, if you look at the flow chart that you need to describe who in America is responsible for a sick organ, that's what you got to go through. And you see what I'm saying? A simple immigrant's mind has trouble grasping this. But this is what you got to make health reform about. You have to implant that into a system like this. So here is how the insurance system is structured. You have all these human species that I just talked about. And here is a painting. This is actually what inspired Mondrian's art. It was actually the American insurance system. So for each of these little boxes, we have a separate deal. We have the federal state Medicaid program for certain of the poor, but it depends which state you're living in. In Massachusetts, you would be state of responsibility, but not in Georgia for the same income. We have the employment-based system, which is whatever you can even think it is. Very often it's a single-payer system, which is you're in a small company. The company gives you one insurer. That's your choice. Choose among that one company. I call that single-payer. And then you have something for the rich, boutique medicine. It's well known in Massachusetts, too. We have for people 65, we have Medicare, but not for the longest time, not for drugs. Then for the near poor, we basically had nothing. That's where the bulk of the uninsured are. For the near poor children, we had CHIP, but there's still 7 million children who are uninsured. And then for the poor elderly, we had the duals. They were partly in Medicare, partly in Medicaid. But then we also have QIMBYs, qualified Medicare beneficiaries, SLIMBYs, special Medicare beneficiaries. We have Q1Is, QDWI, and QI2s, just for this little category of near poor elderly. And this, my friend, is a simplified rendition of this system. The reason I show this to you, if you want to do health reform in America, unless it's trivial, you're going to touch a lot of these boxes, and you get incredible complexity in migration, out migration, grandfathering. All this mess that's in the bill is necessitated by the Mondrian approach to health insurance that we have. The second reason is we do not share a common distributive ethic on healthcare. About a third of Americans, I make this up because it adds up to one, you'll see. About a third wish for an egalitarian system. They basically wake up every morning and wish they were Canadians. Another third would like to ration healthcare more heavily than we already do by income class, by saying there should be a bare bones something for everyone. But if you're richer and the quality of care, access to it, immediacy can vary by income class. And then there is a third who suffer cognitive dissonance. I meet them all the time. You find this, for instance, drug company executives or device company executives who will lament that not everyone has access to their wonderful products, which are wonderful. And I sometimes am nasty on a bad day, and I say, do you realize you're talking about social spending, my friend? Because take Zovadi, this hepatitis, $1,000 a pill. A lot of people with hepatitis C are poor. They're in jails or Medicaid recipient. If you want to pay Gilead $1,000 a pill, that adds a lot to social spending. You have to raise taxes. That's what I mean by cognitive dissonance. You got to put these two things together, and then you realize the complexity of it all. Thirdly, the founding fathers gave us a system of government, for better or for worse. I don't know. I personally think we're so paralytic that it's come to be for worse, in which you really a clean bill. It was designed by Massachusetts policy wonks, wasn't it? Stu Altman, Dave Blumenthal, and David Cutler. Clean blueprint, and then it gets into this hopper of the Congress. And I saw this cartoon in The Economist. You go in there naively, and you think you'll come out with a coherent bill. No way, you might not survive coming out of there. So this is from the Kaiser Foundation website. In the House, this blueprint that they designed was given to leaders in the House and in the Senate, and they introduced it to committees. 3 committees marked up the bill in the House, which then had to be by Nancy Pelosi put into one bill for the House. And they voted on that, I think, in November or October at some point. Then in the Senate, you had 2 committees, the late Senator Kennedy's, then Senator Brown. But he wasn't chairing that committee then. Who chairs Health now?
Harkin does now.
Harkin. 2 committees, and whatever they'd marked up had to be combined into some bill by Harry Reid, and they voted on it December 24th. Now, normally in the U.S., a bill, then you have 2 separate bills. They go to a conference, which is sort of a semi-secret room with the best brains from both party houses and parties there, try to vacuum out all the junk they put into the bill to satisfy the lobbyist along the road or a particular congressman. So that's a vacuum cleaning committee that makes it again a coherent bill. And that did not happen because of the Massachusetts shaku, which is that Senator Kennedy was replaced by Senator Brown, and they couldn't stop a filibuster. And so that, that you had an extremely complicated legislative history. Now you might say, and Tom might say, maybe the Democrats should have given up. Instead, they invented a legislative pirouette that'll stand in history as somewhat unique. I mean, it's very clever, quite devilish, and it got past this thing. So anyway, I said this. Now you have the lobbying in Congress, then you have lobbying as the regs get written. And we're still writing regs. We're not yet done with this bill. It is so long and complicated. So the fourth one is Congress is now so polarized that even if the Democrats had introduced as the ACA bill previously proposed by Republicans, I apologize, should be capital, the latter would have voted against it. It's on Hill, both parties. It's no longer country. It's Party über alles. And I think Tom talks about it. I tell my students, you guys have to fix this. You cannot run a great country with this kind of Congress that we have. This is Bill McInturf, one of the great pollsters in Washington. And what it shows, 1982 is the top bar. This is when Republicans and Democrats voted on the same bill, for the same bill, and that hardly happens anymore. We're completely polarized. So I had been surprised at the chutzpah that you saw that somebody like Senator Orrin Hatch, who had co-sponsored a bill in 1993 with a mandate in it, now called it un-American. The mandate is a Republican invention. Because the Democrats wanted single payer, there would be no need for a mandate. It came out of the Heritage Foundation plan, 1989. You can Google it yourself. It explicitly calls for a mandate. And who put the Massachusetts bill together? Heritage and Urban Institute, bipartisan thing. So it is amazing how this all of a sudden was so un-American that it had to go to the Supreme Court. I don't know if you ever read the Commerce Clause. You have, I'm sure. You've written about it. I read it with total disbelief. It's 2 lines, right? 2 lines. Somehow, I even forget, you shouldn't. Stuff with the Indians and something else is federal, everything else is state. What that tells you about the mandate, I don't know. So I don't think you could ever expect a clean bill coming out of this process. It is simply impossible to have. Now, there was this cartoon in honor of Tom. I put one in too. Are you in favor of the Affordable Care Act? It says absolutely anything better than the job-killing disaster called Obamacare. Now, you think I'm kidding. Treat yourself. Kimmel. Google Jim Kimmel, Obamacare Affordable Care Act, and he interviewed a whole bunch of Americans there and asked them, what do you think of Obamacare? This is terrible, socialist, un-American. What about the Affordable Care Act? Yeah, we're for that. And I mean, it is so hilarious. I showed it to my class. And this lady, this guy asked, do you believe that Obamacare will eventually lead to gun prohibition? And she says yes. So that's the savvy electorate that is supposed to inform this process. So what's ahead for the ACA? Well, Tom said it, and I think he said it correctly. Even if the Republicans took both houses this fall, they won't be able to appeal the bill because the veto in the White House, that's not even worth doing. And there was actually it's a very interesting thing. In May 2009, Senator Coburn, and who was the Burr, introduced a bill that was not too dissimilar from Obamacare. At least they could have talked to mesh that into something they could sign on. The media completely disregarded that bill from Coburn, and he didn't spec it out. It didn't even go to the Congressional Budget Office. But he recently came out with the same crew with a bill basically not repealing Obamacare, but modifying it, which may very well happen. So we will have to struggle onward with the ACA. Now, I also would want to add, you should keep separate, completely separate, the Affordable Care Act, the complexity and all of that, from the unseemly way it was rolled out. That was a managerial issue. That was not a design issue per se. If, in my view, President Obama had followed the great Harvard economist David Cutler's advice, May 2010, a month or two after the bill was passed, telling the Obama administration, what you are doing will lead to a living disaster. You've got to have a CEO who ran an insurance company run this. I would have proposed, because you want the best, a Princeton man. I say this in all modesty, but it is Len Schaefer who founded welfare or created welfare, not welfare, WellPoint. Yeah, WellPoint. No, WellPoint. It's a great insurance company. And he, I think, would have done it, but because he knows how to kick butt, among others, he knows how to build IT systems, etc. A bunch of policy wonks like me, you wouldn't want me to manage anything. I can't even park a car parallel, let alone. But that's what was running the White House, wasn't it, Tom? I mean, they were basically policy wonks. So I think that you should keep separately. What I think could happen, this is the old system we had, actuarially fair premium. This is what Tom talked about, community rating, which will lower premiums for some. Oh, Josh actually talked about that. You had a slide, and you worked the numbers, and it'll raise it for others. Of course, the opponents, naturally, I don't blame them, focused only on this, because, I mean, that's part of the game. You focus on what helps you, and, you know, full truth is not necessarily what Washington lives by. So what could happen, however, is if not enough healthy people, it isn't young versus old very much, because we already age rate 3-to-1. They say it should be 5-to-1. I think 4.5-to-1, 4. That is not where the problem is. The problem is healthy versus chronically ill people. And if a lot of healthy people stay away and chronically ill people sign up, the premiums next year could drift up. So I would say we will not know till 2017-ish how well this will work. We'll see. It might work better than we think, but we will have to see. There was an article that really touched me deeply, The Coming Two-Tier Healthcare System by Scott Atlas in the Wall Street Journal. And I wonder, where has this man lived? He thought Obamacare created two-tier healthcare. We've had boutique medicine for years. We've had Medicaid for years. We've had 50 million uninsured. What is this man talking about? Creating a two-tier health system. Yeah, you will have in America a three-tier health system. Take it from me. It will be a three-tier system. I've written about this. We can talk about it later. So I was really moved by some of these things. I think what drives it is, in fact, not Obamacare. What drives it is, I can't go back here, okay. Now, what drives it is relentlessly growing income inequality, the emergence of ever more expensive medical technology that at one point we will say, if you have the money, have it, but we're not going to give it to everyone. This will happen before you know it, and a growing shortage of physicians. You put those three together and you get three-tier health care. Regardless, even if Obama had never come along, you would still get three-tier health care. So that'll come. So my conclusion then is, you can't pick destructively and have a real sport on Obamacare. And we've had a lot of this. Coming up constructively with an alternative that accomplishes what was aimed for, to cover at least half or more of the uninsured, and pay for it not do it on a deficit again, like the Medicare Modernization Act, is a very difficult thing. And I'd like to see, and you said it correctly, it is better to make repeal small and come with a replacement that we could debate and look at. And we haven't had this. I also think that it would be helpful if people were prepared to fill in a grid, something like this. That's inspired by a paper by Mark Pauly. You want to get some notion of the distributive ethic people bring to thinking about health reform. And so I would say you arrange people, family, by per capita income in the family. You know, family income divided by number of people in the family to give you a sense of how rich or poor these people are. And then you ask, what fraction of that income should they contribute to their health insurance premium? What fraction of their income should they contribute to their out-of-pocket payment? And overall, what fraction of their income should they be asked to spend on health care, and the rest we subsidize? You have to start there to get your ethics straight. And what has always frustrated me, you can't pick destructively on this and that in the Obamacare bill. Start with what any policy analyst will tell you. Tell me your ethics. Tell me your distributive ethic. Once I know it, I can design off that a kind of bill that meets that ethic. And I think there is a huge amount of dishonesty about that slide in this country. And I would just urge here, Josh, distribute it. You and I make this and distribute it next time, and just see. You can even say, do you have your guts to put your name on it? And see where we come up. I actually have an alternative plan but we can talk about. If you challenge me, I'll tell you what it is. Thank you very much.